Welcome to ABC tutorial. Today we are going to talk about vital signs. Vital sign measurements are a crucial aspect of clinical assessment, screening for potential red flags and to guide treatment of patients. Vital signs are indicators of a patient's health conditions, and normal measurements usually provide assurance of good health. Vital signs consist of temperature, pulse rate, blood pressure, and respiratory rate. Sometimes, parameters such as blood oxygen saturation and pain may be added as vital signs. Apart from ill health, vital signs can also be influenced by a number of factors such as age, time, gender, medication, and environment. Vital signs are typically measured when the healthcare provider encounters the patient for the first time. Patients who are ill, like those in hospital wards, need their vital signs measured every few hours. Some severely ill patients, like those in the intensive care unit, are attached to machines that monitor their vital signs continuously. Vital signs are often measured when the patient is receiving medications and also before, during, and after medical procedures such as surgical operation. This is because such procedures may cause significant stress to the client that may result in significant change in the vital signs. The human body temperature typically ranges from 36.5 to 37.5 degrees Celsius. Healthcare providers generally use the axillary, rectal, oral, and tympanic membrane temperature. The electronic and infrared thermometers are the devices most commonly used. Oral temperature is the most commonly used method and is considered very convenient and reliable. To measure the tympanic temperature, the thermometer is inserted into the ear canal. This site is convenient but less accurate and thus not recommended. In measuring the axillary temperature, the thermometer is placed in the axilla while adducting the arm of the patient. This site is convenient but generally considered less accurate. To obtain the rectal temperature, the thermometer is inserted through the anus into the rectum after applying a lubricant. This method is very inconvenient. However, since it measures the internal temperature, it is very reliable and is usually considered the gold standard method of recording temperature. To determine the skin temperature, a digital thermometer can be used to quickly measure the temperature from the skin of the forehead. Body temperature is affected by many factors such as the site of measurement, the time of the day the temperature was measured, gender, recent activity, a patient's relative physical fitness, food and fluid consumption, and in women, the stage of the menstrual cycle. Pulse is the wave of blood in the artery created by contraction of the left ventricle during the cardiac cycle. The most common sites of measuring the peripheral pulses are the radial arteries, the ulnar arteries, and the brachial arteries in the upper extremities, the femoral arteries, the posterior tibialis arteries, and the dorsalis pedis arteries in the lower extremity. Clinicians also measure the carotid artery pulse in the neck. In clinical practice, the radial artery is the most frequently used site for checking peripheral pulsation. In assessing the pulse, clinicians usually measure its rate, rhythm, volume, and symmetry. The normal pulse rate is usually between 60 to 100 beats per minute in an adult, with rate above 100 beats per minute and rate below 60 beats per minute referred to as tachycardia and bradycardia respectively. Assessing whether the rhythm of the pulse is regular or irregular is essential. The pulse could be regular or irregular in its rhythm. Irregular patterns are more commonly indicative of arrhythmias such as atrial fibrillation and atrial flutter. Assessing the volume of pulse is important. A low volume pulse could be indicative of inadequate tissue perfusion and dehydration. Checking for symmetry of the pulses is important as asymmetrical pulses could be seen in conditions such as aortic dissection, aortic coarctation, Takayasu arteritis, and subclavian steal syndrome. The respiratory rate is the number of breaths taken by the patient per minute. The normal breathing rate is about 12 to 20 beats per minute in an average adult. Parameters that need to be included are the rate, depth of breathing, and pattern of breathing. Breathing rates higher or lower than expected, termed tachypnea and bradypnea respectively. Tachypnea could occur in physiological conditions like exercise, emotional changes, pregnancy, and in pathological conditions like pain, pneumonia, pulmonary embolism, and asthma. Bradypnea can occur due to worsening of any underlying respiratory condition, leading to respiratory failure or due to usage of central nervous system depressants like alcohol, narcotics, benzodiazepines. It could also be due to metabolic derangement. Apnea is the complete cessation of airflow to the lungs for a total of 15 seconds or more. Apnea can occur in cardiopulmonary arrest, airway obstructions, and overdose of narcotics and benzodiazepines. Hypopnea is described as an increase in the depth of breathing, while hyperventilation is the term used to describe both an increase in the rate and depth of breathing. That is, hyperventilation is tachypnea plus hypopnea, while hypoventilation is described as the decrease in rate and depth of breathing. Many disorders usually produce some patterns of breathing. For example, buoyant respiration is characterized by a period of hyperventilation followed by apnea. It can be caused by brain trauma. Cheyne-Stokes respiration is a peculiar pattern of breathing where there is a gradual increase in the depth of ventilation followed by a gradual decrease and a period of apnea. It can be due to hypoxemia. Cosmos breathing is an abnormal breathing pattern characterized by hyperventilation at a consistent pace. It can be seen in diabetic ketoacidosis. Orthopnea refers to difficulty in breathing occurring on line horizontally, which gets better when the patient sits up or stands. It is seen in left ventricular failure. Paradoxical ventilation refers to the inward movement of the abdominal chestward during inspiration and outward movement during expiration. This can be seen in cases of trauma to the chest wall. The blood pressure is the force the circulating blood exerts on the walls of the arteries. Blood pressure is written with the systolic blood pressure first, followed by the diastolic blood pressure. The systolic blood pressure measures the pressure in the arteries when the heart beats, while the diastolic blood pressure measures the pressure when the heart rests between beats. Blood pressure is usually measured with a sphygmomanometer. However, semi-automated and automated devices can be used to measure blood pressure. The brachial artery is the most common site for blood pressure measurement. The American College of Cardiology, American Heart Association, ACC/AHA categorized blood pressures as follows. Normal blood pressure is systolic blood pressure of less than 120 and diastolic less than 80 mm of mercury. Elevated blood pressure is between 120 to 129 for systolic and less than 80 for diastolic. Stage 1 hypertension is systolic blood pressure of 130 to 139 or diastolic blood pressure of 80 to 89 mm of mercury, while stage 2 hypertension is systolic blood pressure of greater than or equal to 140 or diastolic blood pressure of greater than or equal to 90 mm mercury. This category should not be based on blood pressure readings at a single point in time, but rather should be confirmed by 2 or more readings, made on at least 2 separate occasions. Individuals are classified according to their highest systolic or diastolic blood pressure category. Pain has been acknowledged as the 5th vital sign by the Royal Colleges of Surgeons and Anesthetists, and therefore it forms an integral component in performing and monitoring a patient's vital sign. Pain is divided into 2 main classifications, acute or chronic. Assessing a patient's pain using a pain scoring system will aid in timely treatment and management of the patient. Oxygen saturation is considered as an essential element in the assessment and management of patient care. The term oxygen saturation refers to the percentage of oxygen circulating in an individual's blood. This is represented as arterial oxygen saturation (SaO2), which is usually measured using a non-invasive pulse oximeter. The normal value is usually between 95 to 100%, while levels less than 92% is referred to as hypoxia.